Hello and welcome to my channel. Today I'm going to explain hemorrhagic shocks classification. It is divided into 4 classes and we will divide them on different parameters. So first of all, the very important parameter is the blood loss in mLs. So if there is going to be less than 750 ml blood loss, it is going to be in class 1. In class 2, about 750 to 1500 ml of blood loss will be there. In class 3, 1500 ml to 3000 ml blood loss. If there is more than 2000 ml, then it is going to directly enter into the class 4. Whereas the second parameter is the blood loss in terms of percentage. If there is going to be less than 15%, then it is type 1 class. If there is going to be less than 15% of blood loss, then it is going to be in class 1. Whereas if there is going to be 15 to 30% of blood loss, then it is class 2. In class 3, around 30 to 40% blood loss, and in class 4, more than 40. In terms of the heart rate, if the heart rate is less than 100, it is class 1. And heart rate of more than 100 to 120, it is class 2. If the heart rate is between 120 to 140, it is going to be class 3. And if there is going to be more than 140 heart rate, then it will be in class 4. Talking about blood pressure is going to be normal in class 1, only orthostatic hypotension in class 2, but a definitive decrease in the blood pressure resulting into hypertension in class 3 and severe hypotension in class 4. In terms of the CNS symptoms, the patient will be totally normal in class 1, whereas the patient could be anxious in class 2. In class 3 type of shock, the patient will be confused, and in type 4, the patient will be unable to respond. So now we will talk about the different MCQs which are relevant to the hemorrhage classification. So if there is a requirement for emergency transfusion and you do not have a specific blood, then you have to see for the gender of the patient. If there is a male, then O positive blood can be transfused. But if there is a female, then O negative blood can be transfused. So what is the percentage of blood? If that is lost, it will result into a significant fall in blood pressure. So in adults, the value is between 30 to 40%, that is class 3. Whereas in children, the value is a bit less, that is if it is more than 25%, in that there will be significant drop in the blood pressure. So if there is a bleeding patient, what can be given? If there is a bleeding in a patient and the patient is also known case of chronic liver disease, then the management would be with the fresh frozen plasma. However, if the MCQ says that there is a bleeding trauma patient and he is a known case of chronic kidney disease, then in that case, the answer will be desmopressin. So the most commonly used blood storage solution nowadays is the SAG-M. So SAG-M is defined as the saline, adenine, glucose, and mannitol. By adding these components to the blood, the shelf life of the blood is increased to 5 to 6 weeks. Thank you very much for listening to this lecture.